Dermabond Prineo is a non-invasive alternative to skin sutures and staples. Dermabond Prineo skin closure system consists of two components, a liquid adhesive applicator and a mesh patch. PA Jana Flenner explains proper closure technique with the application of Dermabond Prineo.
In the past, as far as once the wound was closed, we were looking at different types of dressings. Something that could be occlusive to allow the patient to shower, or an occlusive dressing that would help prevent bacteria from forming in or around the incision itself. And so when we began hearing about Dermabond Prineo, this really did address all of those things. It is a mesh material that helps spread the forces across an area of the skin, so it decreases the tension at the actual incision site. And it also was a microbial barrier for us. We put the knee in deep flexion and we apply the Dermabond Prineo. So we first apply the mesh, and then once that has been applied, then we also coat that then with our Dermabond. The importance of having that knee flexed is because we want to mimic the skin tension as if it were already swollen. If you don't put it in flexion, what will happen is as the skin starts to stretch from swelling, the tension on the skin can cause irritation and maybe even blistering. Sometimes the mesh is not long enough, so we have a second piece that we will trim. And if you're going to overlap the mesh, then you need to make sure that you allow a centimeter of overlap. There is a purple hand grip, and that is on the white remaining pin portion in that twist, and when it breaks, you'll hear a little pop. And then in order to get the Dermabond to flow into the bulb, you need to pinch the nose of the pin and then squeeze that middle bulb area, and that will act like a little vacuum to bring the solution into that for application. We then want to start applying the solution or the Dermabond to the mesh, and we want to do small strokes. Now, if that's side to side or in a downward fashion, it is small sections at a time so that you can see what you've already painted and what you haven't. Otherwise, you'll tend to go back and forth over the mesh, and it will put a layer too thick that you don't want, and two, it'll make it difficult to know what you've covered and what you haven't covered. After you do that, then you want to thoroughly clean any of the excess solution from around the mesh, so make sure you get that cleaned off the skin. Because you need to keep in mind that the activation is actually in the mesh. So once the Dermabond solution comes in contact with the mesh, that's what starts the activation of the drying process. And then it is approximately 60 to 90 seconds after that application for it to dry. And it is really important that you wait for that to dry before you apply any dressing over the top of that if you choose to use it. But it is not required because it is a microbial barrier and no occlusive dressing is required after that application. So post-operatively, before the patient goes home either that day or the following day, I review with them their post-op instructions. So they're always absolutely delighted to hear that they're able to shower. So the Dermabond Prineo allows that wound to be occlusive. So I tell the patients that they can shower. I tell them that they cannot soak in a tub